Hi Dr. Lycan, my name's Kyla Frost. This here is my patient Matt, and today I'm going to be performing my head-to-toe assessment. Hi Matt, my name's Kyla. I'm going to be performing a head-to-toe assessment on you today, kind of working system to system. I may have a few questions for you, so if you just answer them the best of your ability, that would be great. Okay? Alright, first off, I did do the patient's vital signs prior to the recording of this video. His height is 6'4". He is 242 pounds. His blood pressure was 122/80. Heart rate regular at 68. Respirations 18. And his temperature was 98.2 temporal. Okay, the first assessment that I'm going to start is your skin. So I'm just going to kind of look over your skin here. The skin is warm and dry. It's intact. It's elastic. There's no tenting noted. Have you noticed any areas of any lesions, any abrasions? No? Any edema? Any swelling?
Nope.
So as far as I can see, the skin is warm, moist, intact. It has good elasticity. There's no tenting. And next I'm going to look at your hands and your nails. The nail beds are pink with good capillary refill, less than 3 seconds. There's no evidence of any biting. And it does look like you have some trauma to that thumb, is that correct?
Yep.
Okay, so the patient's left thumb does have some trauma. He does have some new nail growth, looks like from maybe a hammer injury.
Something like that.
Okay, and now I'm going to go to his head. Just going to feel your head here. The head is normal cephalic. Don't palpate any masses. Any tenderness when I palpate anywhere? Okay. Your head here. Patient does have a small linear scar on the back of the head. Patient's hair growth is symmetrical. There is some hair loss noted. Okay. Next I'm going to, well, let's see here if there's no infestations, no signs of any ticks, no signs of any lice or nicks. Okay. Next we're going to move to the face. The face is symmetrical. Any tenderness at all when I palpate anywhere? Next I'm going to assess your cranial nerves 1, 5, and 7. So I'd like you to close your eyes for me. This is going to assess cranial nerve 1. I'm going to have him smell this and tell me what he smells.
Cinnamon?
Okay, yep, that's correct. It is cinnamon. Okay, you can open your eyes for me. Okay, next I'm going to assess cranial nerve 5. So I'd like you to practice chewing. Okay. Cranial nerve 5 is intact. And now we're going to go to cranial nerve 7. If you can just close your eyes and open your eyes for me. Okay, good. Patient did that with no problem. Cranial nerve 7 is intact. Now I'm just going to palpate all your lymph nodes. So just give me some time here to feel all of them. Supraclavicular. Any tenderness at all when I palpate?
No.
Okay, good. I didn't palpate any masses, no nodules. That's good.
Good.
All right. Okay, next I'm gonna assess your neck. So what I'd like you to do is just put your head forward and then put it back, hyperextend your neck, and go side to side. Did you hyperextend?
That's about as far as I go.
Patient does have some neck problems, so his range of motion, he is not able to hyperextend as far as he feels comfortable right now. Okay? All right. Now I'm going to palpate your neck here. Don't feel any masses. Okay. Now I'm going to assess the patient's thyroid. So first of all, what I'm going to have you do is I'm going to have you take a drink of water for me, and I'm just going to watch you swallow. Good. Okay, now I'm going to palpate your thyroid, so I'm going to go actually behind you. I want you to turn your head that way for me and swallow. Turn your head that way and swallow. Okay, good. I cannot feel the patient's thyroid, which would be a normal finding. Okay, next I'm going to check cranial nerve 11, which would be resistance to my movement. So if you could just try to push up against my hands here. Good. And I'm going to have you push against my hand with your neck. And again there. Okay, good. Cranial nerve 11 is intact as he is able to push against my hands. Okay, next I'm going to assess your ear. So I'm just going to look at the outside of your ear here. The outside of the ear is intact. The pinna is intact. On this side. The pinna and the ears are symmetrical. I'm just going to look at the outside of your ear here. I don't see any redness. There's no exudate, no discharge, no cerumen noted. Okay. Okay, now I'm going to look in your ear here. The tympanic membrane is intact. It's gray. There's no signs of bulging, no redness. The short malleus is present, and the cone of light is seen. And I visualize the same findings in the left ear. Now I'm going to check for cranial nerve 8, and that is the auditory cranial nerve, and I'm also going to perform the whisper test to see if, what I'm going to do is I'm going to ask you to repeat 3 words after me, and I'm going to do that on both sides, okay? Car, truck, van.
Car, truck, van.
Good. Yellow, 13, blue.
Yellow, 13, blue.
Good. He passed the whisper test, and cranial nerve 8 is also intact. So Matt, the next thing I'm going to do is I'm going to activate the tuning fork, and I'm going to put it on the side of your ear here, and I want you to tell me when you hear it stop vibrating, and I'm going to move it to the front of your ear, and I'm going to time it by the clock on the wall, and I'm going to see how long it takes you to distinguish when it stops vibrating, both on this aspect and this aspect. Okay? Do you understand?
Yep. No? No?
And that was a successful test, as I would anticipate the findings that he would hear it double as long when I put it in front of his ear here. And for the interest of time, I won't do their side, but normally I would assess both sides. Okay, the next assess is the Rhine test. I'm going to activate the tuning fork, and I'm going to put it on top of your head, and I want you to tell me if you feel it equally on both sides. Okay?
Okay. I just feel on top of my head.
Do you feel it on either side more than the other? Okay.
I don't feel either side.
Okay. So he doesn't feel it more on one side or the other. Alright, and now I'm going to assess your eye. So I'm just going to look at your eyebrows here. Eyebrows have appropriate hair growth. There's no loss of hair noted. Eyelashes are intact. Just going to look, if you could just look up for me, and I'm going to look at your, okay. There's no, the sclera is white. Sorry. There's no jaundice of the sclera. The conjunctivi is nice and pink. Alright, now I'm going to just switch my equipment here. And I'm going to actually look into your eye. Okay. You just look at me here. And the optic disc is intact, and the optic, I'm able to visualize the vessels. And the same findings on that eye. Now I'm going to assess your cranial nerve 3, which is your ocular movements. And so I would just like you to follow my finger. Good. Cranial nerve 3 is intact. There was no any extra movement of the eyes, and the eyes were symmetrical. Okay, Matt, now I'm going to have you stand up, and I'm going to have you face me here. Okay, I'm going to have you cover your right eye, please. And what I want you to do is tell me when you see my finger come into your peripheral vision, okay?
Okay. Okay.
Now let's do the other side.
Okay.
Okay, good. And I have a Snellen chart against the door here. So I'm going to have you step back here in the line for me. Okay. There is the chart. And there's my patient. Okay, Matt, if you could please cover your right eye for me and read the line on the bottom, closest to the bottom that you can see clearly. Maybe the line below the green line.
The 10 FD PL TC.
Okay. The right eye is, left eye is 20/20 vision. And now I'll have you do the other eye, please.
FDPLTC.
Okay. And the right eye is 20/20 vision. Thank you. Please sit back down in the chair for me. Okay, and now I'm going to assess your nose. I'm going to switch my equipment once again. Okay, so I'm just going to feel your nose here. Is there any tenderness when I palpate at all?
No.
Now I'm going to occlude one side of your nose, if you could just sniff. Okay. And both nares are intact.